My dear friends, I am Dr. Colonel Brahmajit Singh from Hyderabad. I am a medical oncologist, that is, I am a cancer doctor and I treat all types of cancers with chemotherapy and the latest treatment modalities such as targeted therapy and immunotherapy. Do you want to prevent and protect yourself from cancer? Do you want to know what causes cancer? What are the risk factors, the warning symptoms, and how you can prevent and protect yourself and your family from cancer? And if you are a cancer patient, would you like to know what, when, why, and how of cancer treatment? If you are interested, press the bell icon, subscribe, and stay connected. Why do we treat cancer? What is the correct way of treating cancer? How will we know that our treatment is on the correct lines? What should we ask our cancer doctor that will tell us that our treatment is the ideal one? What is the reason for treating a cancer patient? Is increasing the lifespan the only purpose? Obviously, if you don't treat the patient, cancer will surely kill him or her. But is prolonging life the only goal? My dear friend, no. Definitely not. Surprised? Prolonging life, my dear friend, is one of the goals for treating a patient of cancer. But the main question is, at what cost? Everyone has the right to live and die with dignity. And if you understand this, then you will also realize that treatment of cancer comes at a cost. And my dear friend, here we are not only talking about the financial aspect, there is much more to it. By the time you would have gone through this video, you will definitely know and understand why we treat cancer and what is the correct way of treating cancer. But before I will tell you the reasons for which we treat a cancer patient, I would like you to understand that what I feel what cancer is and how this helps me to treat my patient in a better manner. I consider cancer to be a type of a termite. You know what termites are? They're small insects that make a small hole in the tree and gradually they infest and the whole tree, slowly eating it from inside, gnawing it from inside. What you will see from outside will be a large, beautiful, lush green tree. But inside, these termites, step by step, totally eat away everything. And then, when a gust of wind comes, to your utter surprise and dismay, you suddenly find that the same lush green tree, the trunk broken, fallen on the ground. And if you dare to see inside, it's riddled with holes, completely chewed and destroyed and hollow from inside. Similarly, a patient of cancer is slowly being eaten from inside by these cancer cells. Initially, during the early stages, even the person himself or herself is not even aware. And by the time the symptoms and signs develop, it's usually too late and cancer has advanced to stage 3 or 4, and even before we realize we have lost our near and dear one to cancer. This journey from the early stage of cancer to the terminal stage is indeed very difficult, painful, emotionally draining, and physically challenging, not only for the patient but also the family and friends. The patient also suffers not only the emotional agony of uncertainty of life, but also endures the emotional suffering of his or her family. And my friends, this is over and above the physical pain that they suffer. I am a strong believer that every patient has a right to live and die with dignity, and therefore, before I start the treatment, I take into account 6 goals. If I am convinced that the treatment protocol will satisfy them, I then discuss it with my patient and their near and dear ones, and then as per the desire of the patient and the family, I start the treatment. Now, what are the 6 goals that I'm going to talk to you about? Okay, so the first and the most important goal of treatment for a cancer patient is that we must improve the quality of life of that patient. If my treatment cannot improve the quality of life, then the objective would be to at least maintain the present quality of life of the patient and not to let it deteriorate any further. I feel that this is the most important objective of treating my patient. What would be the benefit if the treatment did help in prolonging life, but the life left was not worth living? Do no harm is the golden principle that I follow and I expect my other physicians to follow. Second goal, which would be to prolong survival, but as I said before, not at the cost of quality of life. The treatment should be such that it should improve the quality of life and simultaneously, as an added benefit, prolong the life of the patient. Third goal, to try to eradicate cancer from the body in totality. This goal is usually achievable in the early stages of cancer, and in the later stages the objective is modified because the aim is now to kill as many cancer cells as possible and not to allow the cancer to spread further and multiply, keeping the first 2 objectives in mind. That is decided that we need to plan the intent to treat, whether we are going to treat with a curative intent or a palliative intent. That is goal number 3. Now, the fourth goal or the objective is to treat the complications which have already occurred, such as damage to the bone by spread of the cancer to the bone. This is due to the damage caused by cancer, and then the aim is to firstly treat this complication and to prevent further complications from taking place. And this is where supportive and palliative care comes in, and as I am a palliative care specialist also, it becomes a bit easier for me. The fifth objective is to prevent the cancer from coming back. My treatment should be effective to prevent this catastrophe. Unfortunately, in advanced stages of cancer and in certain types of cancer, this is not possible due to biology and advanced nature of the disease. And under these circumstances, the objective changes to delay the relapse as much as possible. Sometimes, in order to achieve this objective, a specific type of treatment called maintenance therapy is planned and according to the protocol followed, and I follow the international guidelines. So it's the international protocols which are supposed to follow, which clearly state what maintenance therapy in what cancer should be given and has a survival benefit. The sixth and the most important objective of treating a cancer patient, this is my personal objective. Maybe other physicians may or may not agree with this or may not follow this, but this is my personal objective, and this is to make the patient cherish his or her life. Whatever it be, at the end, it is not the destination but the journey. How beautiful we can make the journey. The onus for this, I feel, lies with the treating doctor, and I, for my part, share this particular objective and responsibility with the family and friends of the patient. Being a qualified NLP programmer, neuro-linguistic programmer, I make sure that my patients also understand that they are in charge of their life and not cancer. In fact, I have made a video in English and Hindi which is available on my YouTube channel with the same objective, and it goes, so what if it is cancer? Cherish your life. And I do tell my patients and their relatives, their human support system, to see the video on my YouTube channel. The family and friends have a very important role to play, and I request all the doctors to spend some extra time with them, making them realize their role and how they can help and make a big difference in the outcome. In short, I tell them to give more TLC to the patient, that is more T LC, tender loving care. The journey of life for a cancer patient is full of turbulence and is indeed very tough. The least we can offer is a joy and love of their loved ones and a positive attitude. The desire to live and the hope that he or she will get well, my dear friend, works wonders, and it makes my therapy more effective. The reason I have shared these goals with you is because next time when you go and meet your cancer doctor, please ask him what are the goals of treatment for that patient. Ask him if the treatment will, number one, improve the quality of life of the patient, 2, prolong life, improving or maintaining the quality of life, 3, will the treatment eradicate cancer in totality, or will it decrease the growth and achieve control over cancer? What is the intent of treatment, curative or palliative? 4thly, will it prevent the complications of cancer, and what kind of supportive therapy is planned to manage the existing complications that are already there? 5thly, will the treatment protocol prevent relapse? Is there any maintenance therapy planned? 6th and last but not the least, what can I do as a support system, as a family member, or as a friend that will ease my patient's pain and suffering and strengthen his or her desire to live and get well? And as a patient, my dear friend, cherish the love of your family and your friends. Every day above the ground is a good day, my friend.